Hello, I'm Paul Beckwith. A paper that has come out recently and that has made a lot of impact and noise is it's coming from Imperial College, the COVID-19 response team. The name of the paper is Impact of Non-Pharmaceutical Interventions, or NPIs for short, to reduce the COVID-19 mortality and healthcare demand. So basically the gist of the paper is if no mitigation or suppression efforts are taken, life continues as normal, then there would be a certain curve, exponential growth of the virus, and then it peaks and then it drops back down. So by various interventions, going from social distancing, self-quarantine for people that are positive, isolation for people that are suspected or come in contact with people that are positive. There's all of these different interventions, to basically shutting down entire cities or shutting down entire countries. So the paper models how these peak curves shift, and you've probably heard about flattening the peak. If we could flatten the peak, then we give the hospital system much more chance to deal with the people that are sick. So I think it's a very, very key paper. There's a lot of frightening results from it, but we've got to look at it. So just before I get into the paper, I just want to show you. So this is my website, paulbeckwith.net. Just Google paulbeckwith.net to find it. And please consider donating on my PayPal to support my work. I will get back to climate change soon, but more climate change stuff. But right now I'm kind of preoccupied by the virus and also trying to brainstorm with some friends as to how to make, for example, a better mask, an inexpensive mask that could protect one from the virus. So I'll do videos on that as my ideas progress. But I think I do have some ideas. I have the engineering background, and I have some friends who are excellent engineers, and we're kind of brainstorming on what we can possibly do. Okay, so of course the virus is here. Just 24 hours ago, this number was at about 200,000. Okay, so exponential growth, enormous growth. Many countries are bad. Italy's quickly catching up to China, and other countries are following. I'm in Canada. These numbers, just last night, I believe, or yesterday, it was 400 and something, 700. This number is climbing very rapidly where I am in Canada. Okay, so, and if you Google my YouTube, Paul Beckwith YouTube, you can see all of my videos, and you can just do a search for specific topics. But as you can see, many of the recent ones are pandemic based. But before then, it's all climate change stuff on a global climate emergency. So this is a paper. Now, there's quite a few authors. The impact of non-pharmaceutical interventions to reduce COVID-19 mortality and healthcare demand. Neil Ferguson, I saw a tweet from him, and seems to have the symptoms of the virus. So I don't know if he's self-isolating or what, or if I don't think he's been tested. He's in the UK. Anyway, we're all at risk from this thing, from catching this thing. Okay, so there's two fundamental strategies to try to reduce the virus, the peak. Mitigation is the first one, and suppression is the second one. Mitigation it focuses on slowing but not necessarily stopping the epidemic spread, reducing the peak healthcare demand while protecting those most at risk of severe disease from infection. So there's an R0, the average number of people that you spread it to, that a carrier spreads it to. R0 is about 2.4 for the coronavirus. So the idea is to reduce that R0 so it doesn't spread as quickly. So that's mitigation. Now, if you reduce the R0 to less than 1, that will reverse the epidemic growth, reducing the case numbers to low levels and maintaining that situation indefinitely. Of course, there's major challenge to each policy. So this paper looks at the UK and US, but it can be applied to any place. So let's look at the interventions that are considered. Well, it talks about suppression in more detail, mitigation in more detail. Looks at the transmission models. The R0 is 2.4, but they look at values between 2 and 6 for the R0. Okay, so first of all, they estimate, this is a current estimate of the severity of cases. I believe this is if hospitals can handle the caseload. So this is a percentage of symptomatic cases that require hospitalization. So from 0 to 9 years old, all the way up to 80 plus. So as you get older, specifically as you're in 50 to 59 and higher, there's a big jump in the rates. The rates are low until you're about 29, 30 or so. Percentage of hospitalized cases requiring critical care in each of these age groups, and the infection fatality ratio. So it jumps quite a bit as you get to higher ages, but this doesn't mean it will always stay like this. The virus is always evolving and mutating, so hopefully it doesn't impact the young as in its mutations. Okay, so the different non-pharmaceutical interventions that they consider are case isolation in the home. Okay, so symptomatic cases stay at home for 7 days. Now, I'm not sure why. This is the UK. They say 7. We're saying 14. Many countries said 14 at first, and they're reducing this to 7. Not sure if there's a valid, really good scientific reason for that. Then you have voluntary quarantine, social distancing for those over 70, social distancing of the entire population, closure of schools and universities. So those are some of the different interventions that are modeled. And this is the scary stuff here. So this is deaths per day per 100,000 population. This is what the model shows for Great Britain here and for the US. So Great Britain peaks, sharper peak. The total is 510,000 deaths modeled. For the U.S., the total is 2.2 million deaths. The peak for Great Britain is this is May 20th. This is about June 5th or so early June in Great Britain, and closer to, June, after June 20th, maybe June 23rd or 25th or something in the U.S. Those are the peaks that are being modeled. In the U.S., the peak is broader and not quite as high, but it's much broader, and it's because this is the cases for all of the different states here modeled separately. So you get some states that are like this, you get other ones that peak up here, and so on. So this spreads the curve over a bit, because the country is larger. Now this is what you do. This is the critical care beds occupied per 100,000 of population. So the surge critical care bed capacity is the red line. Okay, this is the capacity. This is if you do nothing. You get this peak here, which I showed you before. Now, here's your mitigation efforts to reduce the R0 and the spreading. You close the schools and universities, you drop to here. You do I'm not sure if this is cumulative, like you close the schools and then you do case isolation. It doesn't specify that, but case isolation drops the curve, and spreads it, delays it back, widens it. Case isolation and household quarantine spreads it even more. Case isolation, home quarantine, social distancing of greater than 70 spreads it even more. These are the actions that can be taken that then lower the curve. And these are necessary to not strain the hospitals so much. Although even in this case here, this level here is about 90 or so critical care beds occupied, and we can only handle about 10 or so. So it's 8 or 9 times higher than what the hospitals can handle. There would still be lots of mortalities. Now the mortality rate here, it's not really clear, but this is, I believe this is just this doesn't account for swamping out the hospitals and then having many other people that would normally be in critical care unrelated to the coronavirus not getting the care they need. So mortality will be much higher than that. So maybe, I don't know, maybe you can double these numbers because of the hospital situation. I don't know. But it's critical that we, flatten. This is basically flattening and delaying the peak. And we can go back here. This is different R0s, 2.4 and 2.2, and this is peak beds, and this is the interventions that I talked about: PC, school and university closure. This is university closure plus home isolation of cases plus household quarantine, social distancing for people over 70. This is just social distancing, and you can see if this is the number of cases in the ICU, then you can see this is the reduction of the death rate which occurs when you do all of these interventions. So you can get significant reduction by doing these interventions in all of these different model cases. Peak beds and total deaths significantly reduced. Now this is for Great Britain again, showing if we do nothing, if we do all of these things: school and university closure, case isolation, general social distancing, and I'm guessing, should be household quarantine in here too. It's a bit hard to interpret some of these plots. I think they pushed this out very quickly, but you can push the peak from here to, delay it, until the fall, and then it's quite strong in the fall. So one of the things, there's a lot of strategies to do because the population slowly builds up some sort of immunity, and it's called herd immunity. So one of the ideas is if you do all your interventions and knock off the peak and reduce it, then you can, if you cut back on those interventions, the model shows that the virus can come back in these peaks. So then you do another intervention, and then you stop your interventions and it builds up, do another intervention to bring it down. Every time it starts building up, you do another intervention, and it's modeled out to, November 2021, in this case. Okay, this is total deaths in Great Britain for all of these different R0s and different things that you do. So there's lots of modeling. Lots of different modeling, and then there's some numbers in the appendix for this is for the U.S. case, showing ICU bed requirement. So this is the surge critical care bed capacity here, and then this would be the peak if you do nothing, and if you do all of these things, you can delay the peak and isolate it. Now the key thing for delaying it is, hopefully we can have better, we can develop. We need to start working on testing vaccines in people already. We don't have time to wait and do all of the usual testing. We need to try to minimize the harm to people. We need to start. I'm sure there'll be lots of volunteers of sick people that are willing to try different vaccines that will boost their immune system, or that can be applied to people to bring them out of their sickness case. Okay, so things are looking pretty dire with the exponential growth, and this paper goes into modeling a whole bunch of those different things, showing how the peak shifts. So just Google this paper, have a look at it yourself, and like I said, I'm going to start looking at some possible. I'm brainstorming with people to try to figure out what we can do about this thing. Okay, thanks for listening. Bye for now.